The information shared on the Allo podcast is not intended as medical advice. Your medical care decisions should be made in consultation with your physician who is familiar with your specific case.
Welcome to the Allo podcast from the Allo Hope Foundation. I'm Bethany Weathersby.
And I'm Molly Sherwood.
And I'm Katie Shanahan, back from maternity leave and ready to jump right in.
Yay!
Sorry. Is this officially your first day back from maternity leave?
Oh,
Sure is.
Yeah. So
that's so exciting.
That is so exciting. And apologies from us for immediately just jumping into an episode about the NICU, since that's what we're talking about today. Welcome back.
Welcome to the NICU. And I will say, a lot of beautiful things can happen in the NICU, guys. It's true.
It's definitely not my favorite place. In fact, it's
true.
Probably one of my least favorite places ever.
Yes.
But it's also a really important place, right? Our babies receive life-saving care there. And so I do think there can be hope found there.
I guess that's pretty important.
Yeah.
We need that. And so that's why our goal for this episode is to help families affected by alloimmunization to be informed and feel empowered if they do end up in the NICU or if they're currently in the NICU with their HDFN baby.
Yes. And speaking of baby, really quick, can we just pause and talk about our new baby, our new little Logie bear? I think our last, maybe I'm wrong, but I feel like our last podcast episode with Katie in it was the gender reveal. Yeah. Was it? Maybe?
I think so.
Okay. Yeah. Well, can you tell us a little bit about tell us, like, a lot has changed in your life since then.
I know, it's crazy. Going from 1 to 2 children is wild. It's a wild experience.
Yes.
Logan is wonderful. Logan, his name is Logan, but we call him Logie Bear. Term coined by Bethany Weathersby herself.
I love him.
He's wonderful. Our start was very difficult. The last couple of months have been very difficult. He had some medical issues, non-HDFN related. Surprise, that can happen.
Right?
Who even thinks of that? I know.
We were really hoping for a break this time around, but he spent a very brief period in the NICU. Like, he was there for an hour. And so we did get to have the experience of, like, rooming in with him at the hospital, which was an incredible experience.
All right, Katie, one of my favorite things about having a second baby was just seeing another one of my offspring, because you're always like, at least I was just like, is this baby going to look just like the first one? Are they going to be totally different? Are they like, who are they going to look like? And so when I saw Logan, I was like, oh wow, he looks very different from Liam. And he was so cute and, like, not what I had pictured in my mind at all. Did you feel that way?
Yeah, he was it doesn't help he was born in, like, a warmer month, because Liam gets, like, so tan. But Logan is so white. Like, he is, like, sheet white.
Which is the irony that he's not the anemic kid, right?
Yeah, right?
Like, he was.
I know. He had some, like, newborn jaundice at the beginning, but when he first came out, I thought he was albino because he was so white. And then once the jaundice kind of wore off, he's just like my pale, blonde hair, blue-eyed white boy. It's very, like, and he sometimes resembles Liam and sometimes doesn't. And then I think, like, he is Alex's son and Liam is my son.
Yeah, I can see that.
Yeah.
Yeah.
Okay.
Aww.
When I first saw a picture of him, I thought his face was, like, so, like, beautifully structured, like a handsome man. Which I don't know if I've ever thought that about a newborn baby. You know, on SpongeBob, when Squidward, I don't know, he becomes so handsome. He has, like, these really nice cheekbones and, like, a good chin.
Very well.
And I was like, that's what it made me think of. Like, how does he have this beautiful facial structure after just being born? And then his hair was just white blonde. Like, who is this person? So good.
We were gonna name him Brody. Like Brody was maybe I shouldn't say this, but it just felt like such a white boy name. We couldn't do it because he was just so white.
Right. On the
It's too much.
double whiteness.
That is true.
Well, for the first couple of months, we couldn't bring him outside because he was just so sick and just awful. And so, but he also has blue eyes, and so I guess if you have blue eyes, the sun is much harder.
Yeah.
And so when we bring him outside, he's just like.
He's like a vampire.
You brought me out of my lair.
He is like a vampire. He is like a vampire.
Oh my gosh, he's so cute.
Aww.
But we did get him little sunglasses, and he's doing better. He's doing better now.
Oh my goodness.
So. And he's growing on me finally.
Yeah.
Totally understand that.
Yeah.
It took a little bit.
Yeah.
It takes
I
time.
felt the same way.
Welcome to the boy club. Oh wait, sorry.
Yeah.
I shouldn't say that because it's Molly's turn. Sorry.
Oh, okay.
Just got lost.
Well,
Okay.
Welcome. No.
Stop.
Well, we are so glad that Logan is on the explosion of the boy team. Like, our children could populate an entire sports team easily now.
Yes. Welcome, Logie Bear. We're so happy that you're here and that you're thriving and growing. We love you so much. And I just want to add that for me, it was also very difficult. This was before I even had antibodies, red cell antibodies. It was really hard to transition from 1 to 2. Even though my second baby was very easy and just chill, but I remember weeping, just trying to get through the day. So I thought maybe really quick, Molly and I could just share one story from when we went from 1 boy to 2 boys in solidarity with you, Katie.
Thank
so Molly,
you.
do you have a memory of maybe a tough time or just something that happened during that transition?
I was just thinking about this. And first of all, yes to the weeping. And I also think
that makes me feel better.
I also think I blacked out a good portion of these. It's so terrible. But also
it's just
Connor
darkness
was in
your memory.
But Connor was in residency and we weren't near family and, little kids, just all those things. But I was thinking about one of my first vivid memories of overwhelm was, so Hayes was born December 19th. So super close to Christmas.
Oh my gosh.
And then Christmas Day rolled around. And so I have a 6-day-old. And right as the morning started, Connor just somehow became extremely sick and just had a coma on the couch. It turned out he had strep. And and then we had just gotten a new dog too. And so I was letting the dog out to go to the bathroom, holding baby Hayes, and Ronan is just not even 2 yet. And the dog and Ronan just took off in the neighborhood, just running. This is in Iowa. It was very cold. I didn't have shoes on.
Oh my gosh,
and
Ronan! I'm
holding
surprised.
Hayes, running. And I just remember feeling all my organs were going to fall out. And I was I should not be doing this. And it was just so many feelings of I can't do all of the living things that are here right now. It was just, very overwhelming memory.
That's how I feel every day.
Your organs are going to fall out?
Yeah, just like that.
Know that I can't do all of the living things.
I was emotionally worried and also concerned for a prolapse, all at the same time.
Oh
my God. What about you, Bethany?
Yeah, the very first thing that came to mind was it was also in a moment of overwhelm, and I don't even remember all the details. I think Asher, my second son, was a few months old, so it wasn't as fresh as yours. But Liam was just barely 2 and was insane at the time. Okay. Yeah. He's my easiest kid now, but he was really, really crazy at that time. So a lot of times it was he was having a meltdown and I had to carry him and then strap him into his car seat and then I was free. That sounds so terrible. But
no, I totally,
then I could settle because and then that's what was happening. So I took baby Asher, got him in the car, went back and got Liam. He was having a meltdown about something, going boneless. and got him into his car seat, and I was like sweating, got into the front seat, and then I was just like, I'm just like, I want to melt down like Liam. And then I can't believe I did this, but I saw like a bit of Nutella on my jeans, and I just wiped it and ate it, and immediately
no.
I was like, it had this like iron tang, and realized it was poo. It was someone's poo. I don't even know which one.
You'll never know.
I just licked their poo off my own jeans. Why? I literally don't think I've ever just licked a mystery substance. Ever.
Hey, you gotta eat. You gotta eat when you
I think it was like a little tantalizing. Like, I'm melting down inwardly, but there's a tiny
gift for you, Bethany.
lick of chocolate.
A small flicker of hope.
It's just been a flicker. It's just been offered up on my jeans.
Oh
and
my gosh.
Yeah, I survived it.
Yeah, you're here to tell the story now.
I am, but
in
I
our
will
episode
never
about the struggles of motherhood.
never forget that taste.
Oh, yeah. Oh.
Okay.
Okay.
Such an insult. Anyway. Okay.
Oh, so good. Okay, I'm trying to think of how to segue that into talking about the NICU.
There's a lot of baby poop in the NICU.
A lot of poop, a lot of tribulations of parenting.
Yes. A lot of meltdowns.
a lot of
survival.
survival.
There you go.
Yes. Let's transition our journey to the NICU. We have
All
a
right.
lot of good stuff to share. We've had several episodes in previous seasons that kind of like brush up on this topic, but we've never actually dedicated a full episode to HDFN in the NICU. That's a lot of abbreviations. I'm going to say the whole thing just one time.
Do
for
it.
People.
Do it.
Hemolytic disease of the fetus and newborn in the neonatal intensive care unit.
Wow.
Yes.
I feel like
Nice.
you deserve some kind of applause or something.
Thank you.
That was a lot. Okay. From now on, let's just stick with the letters. You know, we're just going to go with the letters, the abbreviations. But it's good to say it once. So we're all on the same page. I think as alloimmunized moms, it is really hard to predict if our baby is going to need NICU time or not. This episode is for everybody, so you can feel more prepared if your HDFN baby does end up needing NICU time. And this is also for those of us who have already had a baby in the NICU and we're still trying to like process everything that happened, that whole experience. This is for providers and basically anyone who might be supporting a loved one who is going through their own NICU experience or struggling with the aftermath of the NICU. So yeah, this is for all. All are welcome here. And here's the basic layout. We're going to talk about why your HDFN baby might need NICU time, what you can expect in the NICU, and what you might have to advocate for in the NICU for your HDFN baby, and then also how to have hope and just really feel prepared if you do have to be in the NICU. So that's our plan for today.
I think it'll be so helpful because something we see a lot in allo moms is they've already had to pour so much of their mental and emotional energy into simply just making it through their pregnancy. And so by the time they get through that and then their baby's born, they're often completely unprepared for the neonatal period, which is also very overwhelming or can be.
Yeah.
So we thought it might help to spend a little time talking about what to expect, what the experience is like for allo moms or can be for allo moms, and then some practical and emotional tips to consider if you're in that NICU experience. And this is going to be focused more so on the NICU experience generally, and not so much the medical details, the medical management of neonatal HDFN. We do have a few podcast episodes if you do want to go more into depth about that. There's some earlier episodes. Season 1, episode 13, we have an episode called Afterbirth Monitoring and Care. And then there's 3 that could be relevant in season 3. Episode 1 is the essential 5 key steps to help HDFN babies thrive. Episode 8 is mental health during and after pregnancy. And then episodes 9 and 10 are Q&A with a neonatologist that we love, Dr. Tim Barr.
He's great. Those are good episodes.
Those are all like such a good complement to this one.
Yeah.
Okay, so let's start with a tiny bit of review about why babies may end up in the NICU with HDFN. So we've probably mentioned this in previous episodes, but just pointing out again that not every HDFN baby needs the NICU, but some do. And the prenatal severity of HDFN does not necessarily correlate with the severity of HDFN after birth. Which basically means, like, if your baby needed intervention during the pregnancy, it doesn't mean that they're going to be in the NICU for sure. And same the other way around. If your baby didn't need intervention during pregnancy, it doesn't necessarily mean that your baby is going to avoid NICU time. And when we think about reasons why a baby might end up in the NICU with HDFN, it is usually if they need treatment for anemia or high bilirubin levels. Sometimes if care teams are just concerned that HDFN issues might present themselves really soon or quickly after birth, they'll plan to send the baby to the NICU. And also it's sometimes just general complications of prematurity if the baby had to be delivered early, because it's rare, but emergent early deliveries are sometimes needed. And then even generally, most HDFN babies are delivered between, would you guys say like 34, 35 to 38 weeks? Like that window is still a little bit of a preemie. So they might still be dealing with feeding and growing and oxygenation needs too.
Yeah, there's kind of a range in that range. Each baby is different, right? And like Logan, Katie, I mean, this has nothing to do with HDFN, but like I was surprised that he did need a little bit of NICU time, but that's just some babies need a little extra help.
The uncertainty of the NICU is really hard to deal with emotionally and logistically. A lot of parents see it as inevitable, and then they're surprised when their baby doesn't go. And then others are completely caught off guard when their baby does go, kind of like when Logan was born. But either way, NICU time doesn't mean you failed or that your baby failed or your doctor failed. It just means that your baby is getting the right level of care for their situation. And that's just a really helpful perspective to have.
That's so good, especially thinking about like, yeah, your baby, your doctor, or you, or whoever. Just there's no one like to blame for this. It's just like you said, Katie, the care that your baby needs for that moment. And it's not a failure. It's not a punishment. It's more like a safety net.
So, okay, let's talk about what to expect in the NICU. Bethany, our elementary education trained teacher, had this idea to do a 5 senses approach to the NICU. So we're going to talk through what to expect in terms of what you might see, hear, smell, touch, and so on. One of the most common questions we get is, will my baby end up in the NICU, and how long will they be there? So we asked this question on social media, and like we said, all babies are different, but this is what we found in the patients that responded on social media. There were 22 of them. 18% said no NICU time. 55% said less than 2 weeks. 23% said 3 to 7 weeks. And one person, which is 5%, said 2 or more months.
That's interesting.
Yeah.
That is really helpful to see that distribution. And I think it reminds me of a common thread that we see in moms while they're in the NICU and they come to the support group. They're in the middle of feeling like they are in a never-ending cycle, and they're having a series of stops and starts, and the baby was looking good with their bilirubin, and now they're not, and now they're back on the lights again, and when will this ever end? And it feels so endless to those moms in that moment. But seeing that really the average is looking like, less than 2 weeks or so, which still feels like an eternity when that's where you are. But having a framework to know this will eventually end, I think can be a little bit of an encouragement.
Yeah. Yeah. So the majority of those who answered that poll either had like less than 2 weeks or no NICU time. So that is encouraging, I think. Okay, let's start my special 5 senses lesson plan. You guys snuck that in there.
Yeah,
That's so good.
Way to tell people what we're doing. doing here? They have to know the plan.
Oh my gosh. Okay, let's start with things that you might see in the NICU. And we started making this list. It just got longer and longer and longer because it feels like you're in another world. I mean, it is. It's like this encapsulated world. When my son Callum needed NICU time, I really just did not know what I was going to see in there. And so we're hoping to bridge the gap for you guys. So you will see an incubator. That's just the baby bed that your baby will be in, keeps them protected and warm, and meets all of their kind of environmental needs. And then a lot of our HDFN babies are going to need phototherapy. Those are the blue lights that you see. And the baby has the cute sunglasses on. I always think they look so cute in those.
Shout out to our merch. We do
I
have
was
a
literally
shirt.
about to say that. Please quote the shirt. Please share
It
about
says
the shirt.
either I wear or I wore my sunglasses at night, and it has a little baby chilling under the lights with sunglasses on.
I love it.
Please go buy that.
Yeah.
Yes, I need to get another one. I had one for August, and he outgrew it in like
need one
2 weeks
too.
or something. Yes, that's so good.
So good.
So that's a very likely thing that you might see in the NICU is your baby under those blue lights and with the cute little sunglasses. And then that also means they're going to be just in a diaper because the whole point is to get that phototherapy, the light on as much skin as possible to get rid of as much bilirubin as possible. So your baby will be, or some people remove the diaper, but maybe that's mostly in other countries. And so other things that you might see on your baby, besides the cute little sunglasses, your baby might need some breathing assistance, which is very common, especially for premature babies. So those who just need a little bit of help with oxygen, they might have this cannula. It's like this little plastic thing that goes in their nose, and it just gives them a little boost of oxygen into their nostrils. And then another one is the CPAP. I don't even know what CPAP stands for. Do you guys?
Yeah,
I'm throwing that to Katie.
It's continuous positive airway pressure. It basically
makes so much
is
sense.
just like gentle pressure to keep the lungs open.
So what does
Yes.
it look like when it's on?
So it looks like-
I have a photo right literally
Yeah.
in front of me. This is so crazy.
Oh my gosh.
Can you guys see this?
Yeah.
This is when Callum was born by emergency C-section and I was all alone. The nurses brought me this I was in recovery and they brought me this photo and were like, look, he's alive and he's great. So this is a CPAP.
Yeah,
Okay,
it's
go
like
ahead.
a
Can you
much
explain it?
much thicker nasal cannula almost. Sometimes it's also a mask, but in the little babies, it's usually
Yeah.
thicker.
And then it's pushing. It's that pressure that it's pushing that. Oh my gosh.
the pressure just keeps their lungs open, from collapsing in between breaths. So it's like oxygen would be like minimal support, CPAP would be medium support, and then obviously intubation would be the most support.
Yeah. Tell us what intubation might look like if their babies need intubation.
So when a baby can't breathe on their own because they're too sick, they might need a breathing tube that's placed down their throat. And it can be really overwhelming for families to see their babies have a tube down their throat. At least for me, it would be. And I'm a nurse and I see it all the time. So, and that tube connects to a ventilator. So the ventilator will do some or all of the breathing for them. And that's the highest level of support that you can have.
And it's like the tube's going in kind of down their throat and it's taped to their face, right?
Yeah. Yep. So they can't pull it out.
Yeah. Yes. By the way, Katie is a nurse practitioner. I know we've said that before, but she's our medical expert today also. So,
And I
we're gonna be
also
asking her
want
a lot
to
of
say,
questions.
Bethany, you made a point that like the NICU is a different world and you weren't prepared for it. That was my world. I worked in a pediatric hospital and I still wasn't ready for it.
Oh,
So,
really? Oh my goodness.
I just want to validate to everyone
that's
that when
good.
it's your own child, it's just very different.
Yeah. Yeah, it's like you're seeing all these things that you're used to in that environment, but then when it's happening to your child, it probably feels totally different.
Yeah. Very foreign.
Yeah, that's so interesting, Katie.
I know there's a lot of like nurses and healthcare professionals in our patient base too. So just want to validate that if it doesn't feel normal to you, it's because it's not.
Yeah, right. That's good. Good reminder.
Great message. It's true. It's because it's not normal.
Yeah.
Oh, that's a good reminder. So, and a lot of babies just need a little bit of help breathing in the first few, sometimes just the first few hours, the first few days. And then as they grow and kind of develop a little bit more, they can kind of get rid of those things. And to give you an idea of this, my son Callum was born at 34 weeks, emergency C-section, and he thankfully did not need to be intubated. He just needed that CPAP. And then like Rose's son, Lucas, was born at just barely 33 weeks. And he did need some intubation because he was just like it was a little too early for that breathing to really be developed enough. So he needed just a couple of days.
Yeah.
And then he moved to CPAP. And then very quickly he moved to just a little bit of oxygen. And then he was good.
Mm-hmm.
Yeah.
Yeah, within a few days. Certainly within the first week, he was just on the nasal cannula.
Right. Okay, and then some other things that you might see are you're going to see like wires. There's a lot of wires, and that can be surprising because it just feels like too many wires. I guess any wire is too much on your new baby that should be like on your chest. But I just remember like this is a lot.
Mm-hmm.
And these are the wires that you might see. The baby will probably have an IV. And so that can be in their little arm, their hand, their foot. It can be in their scalp. And then it can also be in their umbilical cord. Okay, so this is called a central line. And this is a bit bigger of a deal than just an IV. Katie, you are the expert. Will you please tell us about a central line?
So central lines typically in neonates are UVCs, so they're umbilical lines. As you get older, you can have them more peripherally in like we call your anti-Q of your arm, or in your chest, in your neck. And it's just a more direct way to give medications, draw labs, and monitor the baby. And it comes with a little bit of a higher risk of infection than just like a normal IV, which is why they're just so strict about being sterile and making sure they're cleaning the line and giving it good care.
That makes sense.
For HDFN babies, I've noticed that it seems like care teams consider placing those lines if they are wondering if a baby is going to require an exchange transfusion too, just to prepare for doing the transfusion that way.
That's a very good point. Oh, that's just it's kind of falling into place in my mind because my son Callum, he had very high bilirubin at birth, but they just immediately put in the UVC in his umbilical artery, right?
Yeah, what is that? Is that artery?
It's not a vein, or is it a vein?
I think
artery.
it's vein.
Vein.
UVC.
Okay. Thank you. Umbilical vein catheter.
I think so.
Okay. I gotta learn these acronyms.
I never worked in the NICU, so we didn't use those.
Oh yeah, okay.
But it's definitely vein.
Yeah, okay. All right, so you might see those lines, and then you could see a feeding tube for the babies who are still learning to feed and suck and swallow and breathe and all of that. And so that usually goes in their nose, down their throat, and then the little tube is taped to their face on one of the sides, and which is called an NG tube. Okay, what does that mean? Nasogastric?
Yeah, nasogastric.
Hey,
nice.
Okay.
That's the most common type. You can have it go further down, and you can have G tubes, but most are NGs.
Yeah. And I do think that's very common for our HDFN babies. They're dealing with so many things that
eating's definitely on the back burner.
It's like the last thing, right? Yeah. So, okay. So then, of course, you might see some very special objects around your baby, like a passy or binky. And Callum had this, it was kind of like a little sandbag, or I don't know, but it curled around him. It was heavy, and it like encirculated him. I think I just made up that word, but you know what I'm saying. And it gave him like this pressure all around, and they said it was kind of replicating the feeling of being in utero, where so that they're not like flailing around. And that usually premature babies, they do this to make them feel safe and comfortable, and he really liked it. So you might see something like that, or sometimes they just roll up blankets. And the nurses are true experts at caring for our babies and making our babies feel like safe and comfortable and as good as possible. And so these are just really nice, soothing objects that you might see in your baby's bassinet. Okay, well, here's one that was kind of a shock to me and was a little bit unnerving. It just seeing the other babies that were much, much sicker than Callum. Some of them had been there for months. Some of them were so premature. And here's my son, who's like 6 pounds, 6 ounces, just a gigantathon. And it was, I guess, I feel like after you give birth anyway, you're very tender, you know, emotionally. Yes. And it's like, I feel like you're kind of like open or something. And that was just really heartbreaking. So anyway, just kind of prepping you ahead of time to know that you might be seeing babies who are much sicker or are on different paths in the NICU. Just kind of prepare for that. Oh, and then another thing you will probably see is just a lot of in and out staff, nurses, doctors. It was very like interrupted all the time. I felt like everything was interrupted. But Katie, can you just give us a quick overview of like how does that work? Like who is coming in and out? And then also I feel like we almost never saw the neonatologist, the doctor, the pediatrician. It was mostly the nurses. And like, how long are there shifts? When do the doctors come in? Please educate us.
I can try.
Give us your lesson plan now.
Try. Well, the easy one for me is nurses. So
okay.
And I will, yeah, there's so many people that come in and out of your room. It's
You're
like
right.
a train station. And you just
exactly.
you're like, can I just like take my boob out and pump? Like, in peace. But they're there for a reason, right? They're there for a reason. So nurses usually work in nurses do work in shifts, and they're usually 12 hours. So it's either like 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. And so you'll have one nurse during the day, and then you'll have a different one overnight. And then you'll have all sorts of other people coming in your room. So there'll be doctors, nurse practitioners, dietitians, respiratory therapists if your child's on oxygen, sometimes pharmacists. That's just like tons of people, consults. There could be like, you know, cardiology consults, pulmonary consults coming in. And sometimes you might not see the doctor as often because typically there's one attending on the unit for the entire unit. There can be multiple nurse practitioners that are assigned, you know, split the patients, and then there's one attending on the unit, or so there could be multiple like ancillary physicians or nurse practitioners. So you could have med students or residents or fellows that you might see more frequently than an attending. They're all doctors. So, you know, when they're coming in and they're saying, I'm Dr. So-and-so, I'm Dr. So-and-so.
That's a really
You're
good
like,
point.
why are there so many different doctors?
Yeah.
It's all just, it could just be different levels of doctor that all want the best for your baby. And they typically will work like a couple days in a row and then have a couple days off. They don't typically work more than 12 hours either. So you might have a different doctor during the day than you do at night. And it's hard because sometimes you'll have a doctor that you really, really like for a couple days and then they'll rotate off and then someone new will come in and you're like, oh, now you have to get to know my baby. And that can it can be really hard having just so many different people involved in your child's care. But it's a coordinated team. Like everyone's role overlaps in a way that keeps your baby safe. And the more eyes you have on your baby, honestly, I feel is better.
Yeah.
Yeah. Yeah, it would be way worse if no one was coming in, right?
Yeah.
Yep.
Yeah. And what about rounds? Did you talk about how do rounds work?
Yeah.
We
So
always say, like,
Typically, rounds will happen like later morning. So after everyone's got settled, the nurses have changed shift. They've passed off their patients to one another. And pretty much everyone from the team, so that whole group of people I said, the nurse that's caring for you that day, the doctor, the dietitian, anyone that needs to be involved, will go room to room and talk about each patient individually and what they need for that day and what's been going on with your baby. And that's actually a really like rounds because it gives you dedicated time to think about each patient individually. And then there's so many brains coming together to think about your baby specifically. What I really like at the hospitals that I've been at, both with Liam and my second Logan, is the team actually involves parents in rounds. So they'll come and get you and say, hey, we're rounding now. Do you want to come join? And it's a really great time for parents to like air their questions and concerns.
Yeah.
And even if they don't ask you, like that's not a routine thing at the hospital that you're at, you can absolutely ask if you can be involved in rounds. So you can hear exactly what they're thinking and exactly what their plan is for the day.
That's so
Some of this
helpful.
reminds me of another thing that I think we've talked about in a different, I'm trying to remember what episode we talked about this, Bethany, but a lot of moms experience this great feeling of instability once they are in the NICU, especially after they have oftentimes really connected and built a special relationship with their MFM who has been, you know, with them the whole way through. And then they go through this cycle of clinicians and care teams coming in and out, and that can feel super, you know, disruptive, and you feel like a need to advocate every single time a new person comes in. So I feel like the way you're explaining it, like this is why it can be beneficial and why people operate this way is really helpful. And also it reminds me of a resource that we'll share about at the end of the episode that can hopefully help bridge those gaps of feeling the burden of like carrying your baby's history and nuances from person to person. So we'll get to that at the end too.
Yes. I'm so glad you pointed that out.
I might be biased, but the nurses on the unit really are a great resource. I am a nurse. I say that like so biased.
We love
but
nurses.
They're
the
with
ones
you.
that are with
They're
your
with
baby
you. They're
for
there
hours and
beside
hours.
you. They know your baby really well. And if you're having an issue, you can always talk to like a charge nurse. We talked about this a little bit briefly, Bethany. Not even if an issue. If there's a nurse that you really, really like, that you think really knows your baby well, is taking particularly good care of your baby, you can say to the charge nurse, hey, can you assign that nurse to me whenever she's here? Or if there's a nurse you don't like, you can always ask the charge nurse to do the opposite. So use your nurse as a resource when you're there.
Yeah. I did that with Callum. It was, I can't even remember. I can't remember, but I feel like she was being really like rough with him, like physically rough. And just, you know, I think she was just like, you know, she's been doing this for so long but I couldn't handle it. And so I just asked, can you not have her care for my baby? It made me not feel comfortable as the mother. And then, when I told them, they're like, oh, sure, we just won't put, you know, her on your child's rotation or whatever. And then I never saw her again. And it was so great. It was very empowering for me because I felt like I had almost no control and almost no rights as this child's mother. Like I didn't even, when I went in there, I felt like I was a visitor and not his mom a lot of the times. And doing things like that reminded me that I am his mom. And I do get to have a say in some of these things, especially if there's anything that's making you uncomfortable. Totally go talk to is it called the charge nurse or the head?
Charge nurse.
And then she was great. And so many nurses were so good. Yeah. Okay. Good to know. I think that one sense is done.
Module 2 of Bethany's lesson plan.
Oh my gosh.
Okay, what you might hear in the NICU, which I think I feel like this is true for most people I know. Sometimes the really, really strong memories that you can't ever forget are a certain sound. And so I think of that too when I talk about this section here. So one thing that you may hear in the NICU is babies crying, even if they're not your baby. You may hear other babies crying, even though those nurses are able to monitor and watch those babies' behavior and safety from outside of the room. They still may be crying and not being attended to for crying alone. And you may also hear families who are in distress. And you could also experience sort of watching or hearing a rapid response from the care team to take care of a baby who is in crisis. And we are very lucky in that most HDFN babies don't fall into that category of needing an acute crisis response. But it can still be, like you were saying, Bethany, about being in such a raw state and sharing the space with these families and watching and feeling so deeply for them, but also thinking about how that applies to you and what you're going through. That can be really, really hard to hear and just process while you're physically there yourself going through it with your baby.
Mm-hmm. And sometimes, I mean, some HDFN babies are in very critical shape when they're born. Some have to be born very early. It's very rare, but some of them do. And so, I mean, it could be, you know, what's happening with your baby too. So don't want to leave those moms out.
Yeah, absolutely. Yeah. And on that same note of sort of all of the close monitoring that's going on and the quick responses that the teams are coordinating, there's always a lot of beeping. Tons of beeping and so alarms constant. And oxygen monitors and alarms going off when oxygen levels change and all. Can you just try, Katie, will you just tell us about the beeps?
First,
Please
I want you to
beeps.
Imagine knowing what to do about the beeps and not being able to touch the
beeps.
beeps.
Katie.
I can't.
Oh, no, I couldn't.
Oh, it's so bad. I mean, there's so many different things that can beep. I mean, the main thing is the alarms. So your baby typically is hooked up to cardiac breathing monitoring. And so that's always beeping because these babies move around so much. I mean, sometimes it's beeping because there's an issue. Your baby's heart rate could be too high. Their oxygen levels could be too low. Typically, it's because they're moving, to be honest. And there's pumps that are beeping, whether that's a feeding pump, an IV pump. It's just constant,
so many beeps.
Constant beeping.
It is. I feel like you're bringing me back there.
Yeah, the beeps are doing it for us.
Yeah.
And you're also hearing the other, like you are so close. Even if you have your own room, right nearby are all of these other babies, and they all have all those monitors. And so you're hearing, you know, so-and-so's beeping way down the hall, and then it's just...
It's scary
cacophony.
if your baby is beeping more than the usual beeping, and it's just you and the baby in there. So can you also explain, like, who is watching? How do we make sure that baby's okay when that's happening? And because otherwise that can be scary if you're alone with your baby and you're hearing that.
Yeah.
Yeah.
All babies that are hooked up to monitors their monitor is hooked up to a central monitor. So it's typically at the nurse's station, and everyone can see the alarms and the rhythms that are happening in each room. There's actually some monitors that nurses can program to see 2 rooms at a time. So if they have 2 patients, they can see both of their patients on one monitor. And in addition to that, a lot of nurses now carry phones. Back in my day, I'm like aging myself, we had SpectraLink phones, but they're programmed in the morning to pick up the monitoring of your rooms. And so if your patient's monitor is going off, your phone will go off and it'll tell you what room number it is. And so you can either quickly look at the monitor at the nurse's station, or you can go into the room. But if your baby's on the monitor, it's being watched. And if it's not being watched by your nurse, there's a nursing assistant that can come and look at it. And it's a very surefire way to feel comfortable that your baby is safe.
Yeah. Oh yeah, that's really
very reassuring.
And they can tell based off of the monitor if your baby's moving or if it's like a true read on the monitor.
Okay.
Yeah.
And a lot of times, this was happening with my son Callum, like his oxygen sats would just kind of drop and then alarm, but then he would eventually bring it back up on his own. And so like, even though it was alarming, and I would like hold my breath and look like, oh my gosh. And then no nurse would come in because I guess, do they know, Katie, do they know like, oh, he's doing this and he's bringing it back up on his own in time?
They're watching.
Yeah.
Yeah.
So that's nice.
If he didn't, if you would know, because if he didn't come back up, they'd come in.
Yeah. And sometimes they did.
Yeah.
Oh man. It does feel like you're just holding your breath kind of the whole time you're in there. Ooh, yeah. It's a lot. Okay. So
bring us to the smells.
Let's go.
Lay
What are some
smells on
things that you might be smelling when you are in the NICU with your baby? The first thing that comes to mind, it's actually like a PTSD trigger for me, but maybe it's not for others. It's just the smell of an alcohol swab, which is just normal, but it's a strong scent, you know, it's a pretty strong scent. So you might be smelling lots of like kind of medical smells like that. And then you can also smell the heavenly scent of your new baby. You guys, the sweetness,
especially
that's probably the best smell. I know. I think it's the best smell on earth ever. Even their breath. I want to inhale your breath. It's so good. And like, even, okay. So,
you know what you're making me think of? What's that new Disney movie that came out with it's like the modern Rapunzel? Well, it's basically Rapunzel, and the stepmom is like, I'm going to like harness your youth.
Oh yeah, it's Rapunzel.
Tangled.
Tangled. Yes.
Yeah. Tangled.
Yeah.
You're
I'm the mom. I'm the kidnapper mom.
Suck in your breath. Harness this baby.
Yeah. I mean, it's so good. And
Yes.
you just crave it. But like, even if you cannot hold your baby is under those blue lights, I'm just going to encourage you to just take a little hand, a soft little hand, pull it over and just sniff that thing. Sniff it and feel the love entering your body. My youngest boy the other day was holding his grandmother's hand, and she said, I love you. And he said, I love you too. And all of my love goes into our hands. And then the love travels from our hands to our hearts. And
August.
I feel like when you get, even if you can't hold your baby, like you should be doing, you deserve to be doing, and you can't, if you can just grab a little hand, smell their skin, you know, it really, it brings the love to your heart. Okay. And then, bring that love through the nostrils into your heart. Let's talk about some smells for the baby. It's so good. Like when your baby can smell you, that brings so much comfort. And like, I mean, that you are their home, right? For their whole life until that point, you are home. And so a lot of places have these, what are they? They're like little cloths that the mom can actually you can slip it into your bra, and then it gets your scent on it. And then you can leave it in your baby's bassinet, either on their little chest or like wherever, you know, right next to their face, and they can smell you even when you're not there, and it brings comfort to your baby.
So sweet.
Yeah.
Even just like a tiny piece of like extra fabric, like string fabric that you cut in a little square, a little heart shape, even if they don't give that to you, and you can just wear it in your shirt for a day and then come the next day, drop it off.
Yes. Yeah. Even if they don't offer, just say, hey, this has my scent. Can you put it on the baby? Or some people put their breast milk, a little bit of breast milk on that piece of cloth or a cotton pad, and then lay it near the baby.
I feel like, I mean, we talk about how when you're in there for so long, it feels like you're in a weird time warp alternate universe dungeon. And so forcing yourself, if you're going to be eating something anyway, to sit outside, even in like uncomfortable weather, can be like very, very just refreshing to just look at the sky for a few minutes.
Have to get outside at least once a day. Have to.
Yes, that's such a good point. Oh,
it's very hard to do, but
it is.
It just makes such a difference.
Yeah. Good tip.
That's a good roll into what you might feel.
So this could be interpreted like so many different ways, right? Like what you actually might physically feel on the baby or yourself, or how you emotionally or physically feel. So physically with the baby, remember opening up on the incubators, they have those little cutout holes that you can open up and you stick your hands through. Did you have that, Bethany, the NICU?
Yeah.
So I'm just thinking about like
Yes.
feeling your arm up
Oh
against,
my gosh.
like in weird positions, trying to
Oh,
get
yeah.
to your baby's hand and touching their hand, like you said.
And just, I want to touch on the physical thing, because I just thought of this as you were saying. I'm glad that you pointed that out, Katie, that like the mom is still also like in recovery. I mean, we have just been through something very intense for our bodies and our emotions, our hormones and everything. But like, just a reminder to really, I guess, allow yourself to receive the care that you need in that recovery, even if your baby's in the NICU, even if your baby, it's so hard. This is so much easier for me to say than actually do, especially when I was in it, because I did not take care of myself at all. I was just focused on my baby. And then I got this horrific like bladder infection, and I was just, I had an emergency C-section, but then after discharge, I was walking so far. I was living in the Ronald McDonald House near the hospital because it was in a different state that we lived in. And looking back, I did not like take care of myself well. And I remember also like being in so much pain because I did have to be very physically active. I didn't have a choice. I also, in the Ronald McDonald House, I had my 2-year-old daughter with me. So I'm caring for her, and then I'm walking back and forth, this long way from the parking deck to the NICU all the time. And then I remember just I had stopped taking pain meds, and I was in excruciating pain from the incision. And like, I remember like crying one time in the hallway, walking like in the NICU, walking to my son's room, and another mom said, "Are you okay? What's wrong?" And I was just like, "I'm in so much pain from my C-section." And she was just like, "Why aren't you taking medication?" And because in my mind, it was also my first C-section, but in my mind, I was just like, I should already be better by now. And then after talking with her, I actually told my doctor, I think I need some more like narcotic pain meds. And then they're like, sure. And then it was so helpful, you guys. And then it was fine. I didn't need any more after that. But anyway, just saying like, it's okay to respect your own needs and ask for what you need, We actually asked on our Allo Hope social media we asked parents of HDFN babies in the NICU, what was the hardest part of their NICU experience? And here I'm just going to read through some of the answers because I felt very seen just reading through all of these other people's, what they struggled with during their NICU time. Okay, so the first one is not being able to hold him for very long and then seeing him with all the wires and IVs. And actually multiple people had this answer. So I think that's a common thing is like, again, like it's foreign. It's not what we should be seeing, the wires on the baby. And then, it feels so, it feels like just against every fiber of your being to birth a baby and then not be able to hold them. Right? Like, I don't know how to describe that well with words, but it's just such an ache. So that's really hard. And then the next one says, when I couldn't hold my own baby to console him while under phototherapy. And then someone else also said, only getting 1 30-minute hold a day for 2 weeks while on phototherapy. 30 minutes a day for 2 weeks. That's so hard. But it also shows like that baby does need to be there. That baby needs that phototherapy so much. Okay, and then the next one says, not being able to rush the process, a real test in patience. And then kind of adjacent to that, another mom said, all of them may be tomorrows. Oh, I remember that so vividly. You just don't know when it's going to end. Like, it would be so great if someone could be like, hey, here's the date, This is the day you're going to get to go home. But it's just like, I don't know. And then another mom said, baby being discharged from the NICU and then sent back to the NICU 24 hours later. And we do see this with some of our moms where they have to readmit their babies, which would be so discouraging.
That's awful. And another reason why not rushing the process is so important.
You're right.
It's like having that taste of home and having to go back in. I know you had to do that, Molly. I can't even imagine.
Yeah, it reminds me of, it's actually kind of one of the reasons why we talk about how important it is to do that trial off of phototherapy lights before sending a baby home, so that hopefully you could avoid the experience of having to readmit. And we talk about that a lot in our neonatal management, and that's in the AAP pediatrics guidelines too. So just something to keep in mind, because readmission is really, really difficult in its own way.
Yeah.
Yeah.
Totally agree. All right. The next one says, going home without my baby was one of the hardest parts. I feel like we've probably all felt that. I mean, anyone who's had to leave the hospital without their baby. That's really hard. And then the last one, a mom said, watching the oxygen monitor suddenly drop and a rush of nurses running in. That is a very bad feeling.
Yeah.
Are you guys having all the feels right now? Like, just thinking about all these experiences.
So maybe since we're talking about how parents might feel during their NICU stay, what if we each just give a little insight into, because we've each had babies in the intensive care unit, and why don't we just say how it felt for us?
I can start.
Okay.
Yeah,
yes. Tell us.
Let's start with the negative one first.
Okay.
The NICU for me was so awful. I'm just not even going to sugarcoat it. It was so awful. And in retrospect, I fully am so grateful for the amount of care that we had access to after some of the things that we've seen now. But it was just so hard, especially it being my first experience with, a full-term baby, or mostly full-term. I think it was my expectations going in that during the pregnancy, it just felt very uncontrolled, because the baby was inside me, and it felt like it would be safer for the baby to be outside of me and more controlled, and that I was setting myself up for that. And then once we got to the NICU and my baby was there, it was so different, and it was so much more painful and exhausting and emotionally overwhelming than I could have ever expected, while healing from going through, childbirth, which is huge in itself. And I still just even in our conversation right now, I have just such a huge amount of PTSD, talking about the blue lights, or the room that we had to eat in, just
Oh my gosh.
all of these little things give me just so much, my heart is racing, and you can just tell it's a trauma response. And the experience for us was just incredibly traumatic. And I think a lot of it was because it was our first and only experience. And now that I've had a second child and didn't have to go through that, I realize how bad it really was. The physical pain, Bethany, like you said, of standing and walking and having to leave your baby. We actually didn't really leave, but we had a hotel room right down the street. And even that felt too far away, even though we had that luxury.
Yeah.
It was just all very, very unnatural and horrible. It was just really horrible.
I'm sorry, Katie. I'm sorry you had to go through that.
Yeah.
I think you shared that in such a good way that I think is so relatable for probably a lot of listeners, especially the feeling of thinking that you're getting through the hardest part and now you're expecting something like a relief, and then you don't get it. And coping with that while you're coping with giving birth and taking care of your child and recovering from birth is just overwhelming.
Mm-hmm. Yeah, I think I hadn't allowed myself to attach to Liam when I was pregnant. And then once he was born, it was like, I have to protect this baby at all costs. I mean, I felt that way during my pregnancy, but I think I said it in my story podcast episode. Once it was like a true human baby, it just felt so much harder. So
your story episode was one of the first glimpses, I think, where we really gave a lot more thought in the story to the neonatal piece. And I'm really glad we did, because I think that's since developed and opened up a lot more through the rest of the podcast too.
And actually, we didn't include the like patient stories that cover the NICU in that at the beginning of this episode, when we say, you know, go listen to these previous episodes. But there are so many really, really good patient interviews where they share about their own experience with the NICU. So go listen.
Yeah, Amanda's also comes to mind.
Yeah,
too.
I think Amanda struggled too.
Yeah.
Like, I feel we share that together.
Yeah, I think you
right.
did. Yeah.
Molly, do you want to tell us about you next?
Oh, I was going to have you tell about you.
I feel like mine is so intense. It's just so intense.
I know.
You know?
I can try and maybe keep it short. I had a little bit of a different experience in that my youngest, Grayson, was briefly in the NICU, but for better or worse, I was unconscious the entire time he was in the NICU.
It's so bad.
I ended up hemorrhaging after him, and then I had like retained placenta, and they had to take me for like emergency D&C and just sort of conked me out for that. And so I remember, though, in that moment, because I was just like actively bleeding so much, and I felt so unable to hold him or do anything. I felt a relief in that experience, knowing that he was going to be watched after while I was gone. So that was my small exposure to the NICU, specifically with Grayson. But with Hayes, my second son, he actually was readmitted to the PICU after all of his heel pricks from checking for the HDFN became infected and like spread through his body and into his umbilical stump. And I took him to the doctor, just his regular pediatrician, and she was like, I'm really sorry to tell you this, but you have to take him to the emergency room and admit him through the hospital. And I was so upset about taking him to the emergency room. I didn't want to take my newborn baby to the emergency room. And this was like right around the holidays, you know, because I said he was born in December and he was only like 2 weeks old, maybe less. And he was there for a few days. And I do remember the thing I loved about my time was that it was just me and him. And I didn't get that at home otherwise, because I had another child at home. And so some of those memories of just sitting with him are so precious to me. And I feel a sense of gratitude for those moments. But I definitely felt, I think we've touched on this sensation a lot. I hated looking at him in the bed and feeling like he looked so alone. Yeah. And I think that that's like a really common feeling with all of us.
Such a bad feeling.
Yeah. It's just him
just
alone in there.
Hold your baby.
Yeah.
24/7.
Yeah. So that's my little take on it from that experience.
This is kind of a random question, Molly. Can you tell us how you knew his heel prick was infected? I know it's probably unlikely to happen, but it might be good for our listeners to just know kind of like what to look for.
Well, it had gotten, so like normally a heel prick just looks like, especially if they use that little stabby thing, it just looks like a tiny little line, like a tiny line.
Right.
And his just sort of kept getting bigger and bigger and expanding and getting really big and yellow. And like covered
around it, like the skin was
like
yellow?
it had swollen around. It had sort of like grown into a big like pussy scab on his whole heel, and then it also somehow, I guess, systemically traveled to his umbilical stump, and so that the same thing was happening there, and so they wanted to admit for that, and They were really, it was an incredible team. I mean, but we had tons of people come in because it wasn't very common. Like infectious disease was in there all the time. And same as what you're talking about, Katie, of just like
crazy.
All the specialties coming in to triage like a specific issue. But it is we have not talked about that, very, very unlikely, but it does have a relationship with his story, with antibodies. So, but yeah, it was visible. I don't think people should worry that you wouldn't know that it's happening.
Yeah.
You know?
Okay. That's good. That's good. I'm sorry that happened. That's so stressful, man.
Crazy what these kids do to us, you know?
I know. It's just being a mom is like,
I know.
Yeah.
And I remember
really
you
hard.
trying to tell me to have that perspective when we were in the PICU with Logan, Molly, and I just couldn't get there. You were like, cherish this time with him.
Of being alone with him.
Because it's the only time you'll have alone with him.
It's just so hard to say. Cherish this miserable time. Cherish your misery.
Oh my gosh.
No, but it's nice for you to like help find perspective in that way, and in a way to make things better.
Yeah. Okay, well, that's a good segue.
Yeah.
I'll share a little bit. I'll try to be quick about my NICUs, how I felt with my baby in the NICU. And I think I had the gift of perspective from my daughter Lucy, who had been stillborn. That was my first sensitized pregnancy. And then she was affected so early and so severely that we were told we could never have children that survived the pregnancy, because they would also die before viability, which turned out to not be true with the right care. But so, you know, losing our child, our only daughter, and then losing our ability to have more children was, as you can imagine, crushing. And I can feel that I'm going to cry, but I'm going to try not to.
It's okay. Or at least I already cried, so I broke the crying seal. Go ahead.
Really quick, I have only had one dream about Lucy, because I used to pray, like, God, you know what she looks like. Will you please just give me like a dream of her so I can see like what she looks like? And in the dream, it's like me like walking through the streets. It's like downtown. It's kind of like a camera's following me, and I'm like going through these crowds, and I go into the hospital, and I like go up to the like 4th floor, and I'm walking down this like hallway, and then I'm in the NICU. And then I go to her room, you know, and she's in her bassinet, and she's alive. And she was so cute. She had like kind of dark hair. She had that like baby acne, and chubby cheeks. And I was so happy because she was alive. And I was like, oh my gosh, she made it. You know, we made it past viability, and she's here. And then I woke up to the reality that she was actually dead, and it felt like experiencing her death all over again. And I prayed, God, don't ever give me another dream. Don't ever give me another dream of her. I cannot take the pain of waking up to the reality that she's not alive. And I've never dreamed about her again. Okay, so anyway, when I would kind of fantasize about what if we were able to have a living child in the future, I would fantasize about having a living baby in the NICU. I guess because I thought it would be inevitable for us. And
it's
so,
like your safe place. It's a safe place for you and your children.
Baby, yeah, if you have if I had a baby in the NICU, that means my baby made it at least to viability, which apparently, at the time we thought was just not a possibility for us. And so, going into, so my daughter Nora, who came next, didn't need any NICU time, but then Callum was born at 34 weeks by emergency C-section, because it's a long story, but the hurricane delayed his donor blood for his IUT, and he went into distress. And so suddenly, my baby's in the NICU, and I was just so happy that he was alive. I was so thankful. And it was like, this sounds crazy, but it was like my dream come true. I was so happy that he was there, and he just needed some care, and then I would get to take him home. And so even when I left the hospital, after I gave birth, and then a few days later, I left empty-handed, and it was a celebration. And I remember like, Josh, take pictures, because I was in the wheelchair empty handed and just like beaming with this big smile, because I know what it feels like to be wheeled out in a wheelchair, you know, after giving birth, knowing you'll never see your child again. And so for me, I had that perspective. And so that really did, it did help me in my processing of the NICU, because I knew, at least I felt very confident, that we would be taking our boy home. And now he's a healthy 7-year-old. So wonderful, so smart, totally healthy. But anyway, just saying, like, I think that perspective can be powerful. And then also just want to add that I also felt crazy. Like, it was so hard. It was still so hard I would just cry sometimes driving, you know, to the NICU. I just weeping and feeling like pushed to the edge of what I can handle, you know, physically, emotionally, and just feeling so sad that, he had to be in that bassinet alone without mommy by him all the time. So I think that in a way it cushioned me and protected me, having that perspective. But I also really did struggle when he was in the NICU for 3 weeks, and it was so hard. So that's how I felt.
That's incredible and just overwhelming, and such a gentle and kind lesson on perspective, which can be a really hard thing to talk about. Because you don't want people to feel like they're not allowed to feel how they're feeling. And you don't want people to feel guilty for, you know, moments of, or long moments of grief and overwhelm, and, or even feeling guilty for the gratitude of the good outcomes. And why do I get to have this?
Right. I know.
It's really hard. And I feel like you just always thread that needle perfectly when you talk about that. And I think it's we're really lucky to get that education. You know, Katie and I haven't lived that. A lot of our listeners haven't lived that. But perspective is a huge gift. And it's unfortunate that so often it is just so excruciatingly hard learned.
Oh, man.
But getting to learn it through you and through other people and through our experiences, also watching what NICU care can look like in other countries is just such a gift of that knowledge.
Yeah.
While also being careful not to lay guilt on people for, it's just so difficult to thread that needle. It's something I think we all really struggle with. At different times in our work, just trying to grapple with supporting each other and getting everybody through their individual situation, and also having gratitude for life and for resources and for living children when it happens. It's just really, I'm really just grateful that you shared it that way.
Oh, thank you. I rarely share that story because I don't want it to feel like I'm saying that anyone else's NICU experience isn't horrific or isn't traumatic. You know, I want people to feel valid in whatever they are feeling in whatever circumstance. Even if when the baby after that, August, he had to they took him for observation for a few hours. I was out of my mind with grief, just weeping, because I couldn't stand him being away from me for just a few hours. Isn't that, and like, I don't know what I would have done if he had gone to the NICU. It was just like, I just think that
this the perspective goes both ways too, right? Because we had this awful experience in the NICU, which was like your safe place, Bethany. Yeah. But then after this awful experience, our family finally got to experience what quote unquote normal families go through. Nice. And we were able to cherish that experience more than I think we would have if we hadn't gone through the NICU experience.
Yes.
So just like the rooming in, which is like completely normal and what most people do and completely take for granted. We were just like so wrapped up in cherishing that time. And so, like you said, Molly, there's just so many different ways to have perspective, and none of them are right or wrong. And yeah, I think we all do a good job of supporting each other through our unique experiences, for sure.
I think we also learned so much, not only through our various personal experiences and watching other women's experiences, but also I feel like it's such a privilege that we've been able to see what a NICU can look like in a lower resource setting, like we've talked about before in Kenya. And it helps us, again, not all the time, but have moments of gratitude, of saying, wow, the care and support that's available to me is a gift. And, you know, not all mothers have access. And, you know, even if they do have access to a NICU where they live, it may not include food, a chair, a private space. It may not have a nurse who has time to look at your baby. It may not have time to do a blood draw for a day, 2 days, 3 days. They may not be under monitoring. They may not have the tools needed to give baby intervention. And they may not even have the equipment to treat HDFN. And so, again, it's like we always want to pause to create this perspective, hopefully in a way that enriches somebody's understanding and experience, but never in a way that feels overwhelming or would create a sense of guilt, you know?
Yeah.
Or diminishes it in any way. Yeah.
Very good point. And just to touch on the NICU experience that we had when we were visiting a NICU in Kenya, it was incredibly, and even saying this makes me feel like I'm just so entitled or something. But just to share, you know, it was very traumatic. It was heartbreaking. And I would say most of the babies were not on a monitor, right? And because they didn't have enough monitors. And so even like earlier when we were talking about like the incessant beeping, right?
Right. That's
it's so invasive and overwhelming.
Like, oh,
I know. The beeping, it's like interrupting my peace. And then what so many mothers would give to have continuous monitoring like that. They don't know how their baby's doing. You know, their baby's sharing a bassinet with 2 other babies, you know. A lot of babies don't have access to phototherapy lights. And so I think that this is, like you said, Molly, this is a really complicated thing to talk about because we want to make space to feel all the grief and all the gratitude without the guilt. All the grief and the gratitude for what we have to go through, what our babies have to go through, what our babies are receiving, you know? And that perspective also applies to just having a living baby, right? Who's made it through the pregnancy and my baby's here and alive. And like, you know, why did my baby make it and that other baby didn't make it? Why did her baby not make it? And so, I think that it's good to appreciate whatever you're feeling. And like, those feelings are valid. It's valid for us to be absolutely crushed and heartbroken for the babies who do not have continuous monitoring, who deserve it and need it. And then we can also feel super overwhelmed by all the beeping, you know, and like the interruptions and things like that. And so also just kind of taking a moment when possible to really remember the miracle of our child's life and feeling really humbled by that and just grounded and again, permission for grief and gratitude to be present without the guilt. It's really good.
I'm really loving this episode, guys.
I am too.
Go ahead, Katie.
I was just going to say 2 things can be true at the same time.
Yes. Yeah.
Okay, let's talk more about feeling hope in the NICU.
Yes.
So we asked moms on our social media page, moms of HDFN babies, to share a NICU moment that brought them joy. And there were some common themes, but I loved all of these. So some were like practical milestone things. You know, somebody said seeing a downward trend in bilirubin levels. You know, his bilirubin levels kept dropping. just those sorts of things that give an indicator of improvement. And
that feels so good, especially after your baby. Like, it can just take so long sometimes, and you're just like, you know, it's climbing, and it plateaus, and then you don't know when it will or if it will go down, and then you see a trend. It's like lower. It's the best feeling. It feels so good. Yes.
And then there were so many things about nurses, obviously. Yes. Somebody said the sweet nurses looking after him. Someone said the nurses.
Yes.
Exclamation mark. So kind and knowledgeable. We learned so much from them. And then one said, an incredible nurse who chatted with me for 4 hours while I rocked my baby.
Wow. Oh my goodness.
Just giving the time. Oh my gosh.
Must have been a slow day.
You're like, she only had one baby to watch that day.
Sorry. That's amazing. I don't want to make light of it.
Like,
but
she's probably so tired.
Yeah.
Oh yeah. She could absolutely be eating or peeing. And instead she chose to spend time with that mom.
She could just sit on her phone and do something else. Yeah.
Oh, that's amazing.
This person said I could dress him in his own clothes, which is like a little socks, hat, cute little brother outfit. Somebody said finally seeing her beautiful face after she graduated from the eye covering and the CPAP mask.
That's so good to see your baby's face.
Yeah. Oh my gosh, that makes me want to cry. I don't know.
Oh my gosh. It's just so, like.
I just remember the NICU team kept pressuring us to pick a name, and we didn't name him until like day 6 because of all the stuff on his face.
See him.
I'm like, I can't name him. Yeah, I don't know what he looks like. So
my gosh,
that one hit harder than I thought it was gonna hit.
Oh yeah. And then somebody said the tiniest of milestones that absolutely moved mountains. Similar to what we're talking about the Billy, just like little things, and
we feel so
many
proud
milestones during that tiny window of time.
But we feel so proud as moms. I remember like when Callum finally got to take the feeding tube out. And like most babies don't have a feeding tube, but I was so proud. I was just like, "You did it, man! This is incredible!" You know, it's really encouraging.
Somebody else said, I was finally able to hold her and nurse her, which especially when the babies are under lights and the opportunity isn't there for so long. And same. This is another, I got to spend hours in the recliner with him on my chest, just us two together.
Did you write that, Molly?
I know, I was going to say, I relate to that so much.
Oh, it's so sweet.
You feel like you're in your own really tiny little bubble, you know, me and my baby. So encouraging.
Okay, so we also thought it would be helpful to talk about, you know, having that perspective and that gratitude, ways you can make your NICU stay feel special for your family, especially if you're really struggling while you're there. And these are just some ideas. One of the things that we really like to do was dress our baby up like when we could, once he was off phototherapy lights and was just doing the feeding and growing thing, like planning the first outfit, putting them in their first outfit. Something else you can do, which may seem silly because if you have an HDFN baby, they'll probably have goggles on their face and can't see anything.
Or their eyes just closed.
Their eyes, they have no eyesight. They have like negative eyesight when they're born. But we put up like little things in the room to make it feel more homey. So we put like a photo of us with our cat in the incubator, which thinking about it now is just laughable because they couldn't see it, but it just made us feel like we were close to him when we couldn't be holding him. Or putting like a balloon in the window or pictures on the wall.
Oh my goodness.
Bringing your own sheets or blankets so it feels more like a home environment where the baby's laying on a soft blanket.
I remember like having Callum's blanket. It was so important because it smelled like me and home, and then having it in his room was so special. And I knew like even if he's not able to wear clothes or whatever, I can still kind of at least put this blanket next to him or on him over the wires or whatever. I mean, this was after he was done with phototherapy lights. And then when we got to the point where he could bottle feed and then breastfeed. It was just so nice. And also the skin to skin kangaroo care. He would be on my chest and then put like that blanket around him, and it was like so comforting to me. His blanket was comforting to me as well. So that was really nice. I'm just thinking about like breastfeeding him, like actually breastfeeding him after the tube feeding, and then he finally could take a bottle a little bit at a time, and then like finally getting him to latch on the breast was so exciting and like one of those milestones that I did not know if it was going to happen or not. It was so good. So I wonder if we should talk about the feeding aspect. I feel like that was a huge focus in the NICU, right?
Yeah.
It was just, at least for us, it took him forever to like be able to feed completely on his own and then gain enough weight and like survive on the food that he was able to intake. And that was kind of a big stressor and something that he talked about all the time. So I'm wondering if we should at least touch on that a little bit.
Yeah, I think
for other NICU parents,
one of the amazing things and the tough things, two things can be true. We're going on this thread.
Okay.
Is that I think feeding your baby, being able to feed your baby is a way that you can feel like you're caring for your baby in the NICU when you can't really do anything else. And, you know, there's so many different ways you can feed your baby when they're in the NICU. You can breastfeed, you can pump, you might need donor milk, you might need formula. And it just, with all of those options and with everything going on in the NICU, just how important it is to honor your baby's feeding needs and feel like you're caring for them while also respecting your own needs and your mental health. And for some moms, at least for in my situation, the pressure to breastfeed in the NICU was very overwhelming. And it felt like the only thing I could control. And it was the only way that I could actively help my child. And that's kind of how it was.
Which is funny. I was just going to say, a lot of breastfeeding is out of control. At least it felt like
I know.
Yeah, that's so funny. Like in your control, every time I tried to breastfeed like a new baby, I was just like, this is out of control.
Yeah. Well, he never latched, so I was pumping. I was exclusively pumping, so maybe that felt more control, but
oh yeah, I could see that.
So I pumped every 2 to 3 hours on the dot. I did not rest or skip a session, and
through the night.
Yeah,
Katie.
And at times
that's fine. Like if that's what you want to do.
Made Rose do that.
So not necessary. You definitely made Rose do that.
I totally did.
And I let her skip. I gave her the grace that
I
nobody
did too.
gave
She
me.
wasn't doing that at night. She was not. When she was with me, she was sleeping.
But there's a lot of pressure around feeding your baby, even when you're not in the NICU, right? There's outside pressure anyways. And sometimes it's from the medical team, sometimes it's from ourselves. And it's easy to feel like if you're not doing something actively for your baby, you're failing them in the NICU. And that's definitely not true. And I think every parent should feel empowered and deserves to feel empowered to make a feeding decision that feels right for them and their baby, whether that's breastfeeding, pumping, combo feeding, stopping altogether. It's all still an act of love. And rest and mental health and being present for your baby matter just as much as what they're being fed. And the right choice is one that works for you and your circumstances. So
yes. Yeah. That's such a good reminder. Thank you for saying that, Katie. I think a lot of us don't envision being in this situation, right? And so a lot of times the feeding choice we have to make is different than what we envisioned, in like the perfect scenario. And that's hard. That's very hard. Yeah. So that was a good reminder. And also that our needs are our baby's needs, right? Like we cannot meet our baby's needs unless we are ourselves cared for. So, I with my son Callum, I really wanted to breastfeed, really wanted to breastfeed. And so, I was glad that the nurses were on board with helping me do that. But I mean, it was weeks before I could actually breastfeed him, and he was tube fed, for a while, quite a while. And then the big, like I just said earlier, the big like triumphant moment was also just feeding him a bottle and like, oh, he can swallow and breathe and not choke or like not have an oxygen desat, and then feed enough where he's growing a little bit. And then eventually we got to the breastfeeding part, and then we were able to breastfeed for a whole year. But at the beginning, I was, I had to pump. And then at the Ronald McDonald House, just the one I was at did not allow you to have a refrigerator in your room. So I remember just like walking down this long hallway to the shared kitchen and like putting my breast milk in there and then collecting it and taking it to the NICU. And then they would try to give him some. And it was really, really hard and not what I envisioned. And for quite some time, he got formula, and that was fine because that's what we needed to do at the time. And then I was really, really grateful to be able to go on to breastfeed him. But it was a ton of work. And I know that it's not possible for everyone to be able to have that. I will say, I think this one nurse really played a part in our success in breastfeeding. And she told me that she was like, you don't need to make yourself get up every 2 to 3 hours throughout the night to pump because you are recovering. You are a recovering patient. You have to rest, and you won't even you have to give yourself a 5-hour window of sleep uninterrupted every night. I mean, not have to, but like this will help you if you decide to do this. 5 hours of sleep uninterrupted, and then pump when you get up. And so at first I was like, whoa, I can have this freedom. But then it was so good. I knew like whatever happened during the day, I knew that night I would have a 5-hour window where I would get to sleep uninterrupted. And I will say that was a perk of him being in the NICU was he was being cared for, and I was able to get 5 hours of consecutive sleep, and that was so important for me. And it didn't affect my milk supply. So anyway, just encouraging you to give yourself a span of time to sleep every night if possible.
I wish
really
you
helpful.
had been there for me. Told me to go to sleep.
Oh my gosh. Well, sometimes we hear this, like, if you don't pump every 2 to 3 hours, you're going to lose your milk supply.
Yeah, exactly.
And so for a lot of moms, especially our listeners, we do feel better when we are prepared, if possible, for what's ahead. And I just want to talk through some ideas for helping our listeners be prepared in case they have an HDFN baby in the NICU. So first of all, it is helpful during your pregnancy to schedule a NICU tour. If you do know where you're delivering, go ahead and set up a NICU tour, and then you can kind of walk through and at least see where your baby will be if your baby does end up needing NICU time. And then you can meet with the neonatal team. And I think I always met with the head, the charge nurse as well. And then just talked through, like, here's some things I'm concerned about. How does this work? And I said, like, what if I want to breastfeed? Like, is that possible? What does that look like? And then they showed me ahead of time, this is what you do. This is how we support you. And then just go in with a list of questions and ask them all the questions. It really helped me prepare for the possibility of my baby being in the NICU. Just to help you feel prepared, and also to help you kind of know some of the things you might end up needing to advocate for if your baby's in the NICU. I want to point out how HDFN babies in the NICU might be different from more typical NICU babies. So number one, we've already talked about this so much, but our babies have a unique type of anemia. They have hemolytic anemia if they are anemic, and they don't have the very, very common iron deficiency anemia. And then our babies, I've never seen, in all these years, I've never seen an HDFN baby who really needed an iron supplement. And if you want to hear more details about that, go listen to our mini episode on iron. It's so good, guys. But yeah, you might have to advocate for your doctor, if they really want to give iron supplements, for them to check the baby's ferritin first. And if the ferritin is low, to give the baby iron supplements. But that's kind of a big one. Just at least just kind of on the mother, like, oh, I have to check again. Like, please don't give him iron. And then remember, our babies, if they do have high bilirubin, it's hemolytic jaundice. It's different from typical jaundice. And so you might have to advocate for more frequent monitoring and just keeping a closer eye on it, and making sure you have that trial of lights when your baby's going down. And then a lot of times our babies are not as premature. A lot of times in the NICU, we're seeing these super premature babies, or babies with, really intense issues that they're dealing with. And for the most part, most of our HDFN babies are just dealing with some temporary treatable issues that they need a little bit of extra help with, a little bit of extra monitoring. Sometimes our babies are just there for the monitoring and then they come back, And I don't know, it feels like a little bit of a relief to know that our babies, there is treatment, and our babies can go on to live completely healthy lives when they receive the right care. So
yeah, even sometimes HDFN babies are like relatively easy. And so where most NICU nurses would have one patient, they might have two, and the second patient might be your HDFN baby because they just need a little bit of oxygen, or they need a little bit of feeding support, and they're not, intubated and vented like a 24-weeker.
That's really good. Have I said perspective enough? I need a new word. Yeah, it's really good context though to know. Yeah, where most HDFN babies kind of fall on the spectrum.
Yeah, and it's not like the ones that need an exchange transfusion. That would obviously be a much sicker kiddo,
Right.
but ones that are just there for some phototherapy.
Yeah.
And I say just with the disclaimer that
Yeah.
that traumatized the crap out of me. But
Yeah, it's still horrible for the family. But my good friend who's a NICU nurse calls it like, oh, I had a feeder and grower last night.
Yep.
It's just
Easy.
quote, easy feeders and growers.
Easy for the nurses, not easy for the family. Yeah.
Exactly.
yeah, that's true.
So, okay, I want to go through some really important, specific, tangible resources to lean on when you are navigating the NICU experience. So the first one that I think we should direct people to is our neonatal excellent care checklist. It's on our website, and we'll put it in the show notes too. Just an awesome 2-page summary of what we're looking at for neonatal management for HDFN. And you can ask for that to be scanned into the baby's chart too, to be referred back to. Another awesome resource that we have is called the HDFN Health Record. Have we talked about that much on the podcast?
Not yet.
Not
I
yet?
don't think so.
Oh my gosh. Okay.
It's so good.
Well, Bethany, you really just chef's kiss blew that one up. But also we had a lot of help. Kate actually helped to draft some early iterations of it. We had we had some neonatologists take a look at it, and we created this HDFN health record, which is basically like a paper health record document specific to HDFN babies that you can carry with you from the obstetric management place for your baby's history all the way through to the NICU if you end up there, to the OB team, to the neonatologist, to the pediatrician. And it's a way to sort of log everything that has happened to your baby so far and keep track of all the treatments they've needed and their laboratory values all in one place, so that it helps to maybe ease that burden of dealing with transitioning care from this provider to the next, and the next doctor the next day, and then the pediatrician. It's an awesome resource. So we'll link to that too. It's on our website. And then we've talked about the guidelines that are developed just last year for neonatal management of HDFN that were part of a larger effort for HDFN prevention and also pregnancy management. But there's one manuscript specifically planning to be published on the neonatal management of HDFN. And so when that's out, as soon as it's out, we'll put it in there and use that as a reference too. And then don't forget to use our patient support group. We get a lot of questions on there, just moms needing support or moms who want to share, if they want, they can share, my baby is going through this. What do you guys think this means? And people can just sort of brainstorm and offer support together. So a lot of really good resources to help carry you through.
Yes, good point. It is so helpful to be with other people, even just virtually, who can understand what you're going through, So next up, I wanted to just quickly touch on how we as parents in the NICU can kind of feel a little bit more empowered to, oh my gosh, what am I saying? Okay, sorry. We can be a little bit more empowered and have a little bit more control in our baby's care. And we do have rights, like as the parents. I know for me, it felt like I was just a visitor, like I said earlier. But we do have some ways that we can feel a little bit more in touch with our baby's care. And a reminder that parents, you do have the right to join in on the doctor's rounds, like we said. And then if you don't actually consent to something, like our neonatologist really wanted to give my son Callum some iron supplements, and I said, I do not want you to. He's had multiple IUTs and then transfusion. I think his iron is extremely high. And he said, no, I think this will help him. And so finally I said, can you put it in my chart that I, as the mother, say I do not give consent to iron supplementation for my baby? And they put it in the chart. And so you do have the power to say, I do not consent to something. And then I said, let's check if you want to give him iron supplementation, that's fine. If his ferritin is actually low, if his iron levels are low. And then they did a test and they were extremely high. And so, yeah, just remember that you can have them put some things in the chart, if it's your wishes. And then you also have the right to access your baby's medical records through the patient portal. And that can be so helpful because they put the test results in there pretty quickly most of the time. And then you can see them and just feel a little bit more in the know about what's happening with your baby.
Mm-hmm. And Molly did a really good job about talking about some of the resources that we have at AHF, but we also want to acknowledge that there's outside resources too. So in the NICU, if you need anything related to the care that your baby's receiving, something you like, something you don't like, the charge nurse is always a great resource. And then additionally, a social worker. Sometimes a social worker will automatically come to the bedside, introduce themselves, let them know what they have to offer. Sometimes you just have to ask, but they can help with emotional support, help with resources, financial things, logistical concerns that you might have with other family members at home, or accommodations like the Ronald McDonald House that Bethany stayed in, planning for going home. Another resource in the NICU that can be super helpful or be really hard is something called Angel Eye. It's a camera system that some NICUs use so you can see your baby remotely. If you can't be at the bedside, it's actually a camera that looks down onto their bed and it hooks up to your phone through Wi-Fi, similar to some of the baby monitors that they have now. And you can just watch them. And sometimes it's really great. And sometimes you're like, my baby's crying. Can you please go get them? And it's so hard. So think about that one before you jump to it.
Yeah, I can see that going both ways. Yeah.
And then outside the NICU, there's also a lot of NICU specific resources. And one of them is an account called Dear NICU Mama. It's a really wonderful community of NICU moms that share stories. They have a podcast. They have letters of hope, which I remember reading when I was in the NICU. And it's really validating to your experience, no matter how sick your baby was, how long you were in the NICU. It's just a really great community of people. And then also Project Sweet Peas, they're a NICU-based organization that provides care packages, memory items, and support programs for NICU families, which is great. And then shout out to Owlette, going home with an Owlette monitor. We talk about this a lot, brings a lot of relief and comfort to families after their baby has been in the NICU and hooked up to all those wonderful alarms that we talked about. It's sometimes hard to make that transition from knowing that your baby has been so closely monitored to just going home to nothing. And so the outlet can help bridge that gap if that's something that you want and feel comfortable with. It worked for our family very well. And I know, Bethany, you used it as well.
Well, thanks for joining us, everyone. And I just want to say, like, you parents are incredible. Like, getting through all of this is really monumental, and it's such an accomplishment. I think we don't give ourselves enough credit. Like, we're incredible. We're amazing. And we're honored that you're part of our community at Allo Hope. So thanks for joining. Always reach out to us if you need help or have questions. And don't forget to come join our patient support group for alloimmunized moms. Katie, I kind of want you to finish us off.
Which part?
Do it.
Which one?
The
sign-off.
outro.
Oh, okay.
Yeah.
The sign off. There you go.
All right. I always cry when I do this.
Do you?
Yes.
I like that with weird stuff too.
Really?
I like.
Yeah, because
I can't
you were here. You were here for me. Okay. All right.
Oh my gosh. Stop. Stop.
All right. Here we go. I'm not going to cry.
Okay.
Whether you are a patient, provider, or otherwise affected by antibodies in pregnancy, we are here for you. And we really are. We have great resources on our website at allohopefoundation.org. That's allo spelled ALLO, hopefoundation.org.
Thanks for listening.
Thanks for listening.
I was
I've
trying
never
so
teared
hard
up.
not to.
I am tearing up at the sign off. Oh my god.
The Allo podcast is offered by the Allo Hope Foundation, a nonprofit organization. This means that our ability to continue this work depends on corporate sponsorships, small research grants, and donations. While sponsorships and grants are vital, they're often restricted to specific activities, and they do not cover the everyday work that keeps our mission moving. Things like creating educational materials, writing grant applications, running our social media, and especially managing our rapidly growing patient support group where we counsel women every day. They also do not cover the direct support we provide to families who cannot access life-saving care, whether that's the cost of an antibody screen in Kenya or bus fare for a mom in the US who needs to travel for an intrauterine transfusion. If you've ever wondered whether a donation of any size makes an impact, it truly does. Please visit our show notes for information on how to donate to AHF or to become a recurring donor. Your support gives our small organization the stability we need to continue this work and ensure no family faces HDFN alone.